When your water breaks, should it have a clear color? If it's brownish, what does that mean? Should you be worried?
Amniotic fluid tends to be clear. In general, it tends to be clear. We spoke a little bit about meconium fluid. Meconium stained fluid will tend to be a little bit on the greenish side. I suppose someone could describe it as being brownish. So if you have that discoloration to the amniotic fluid, there's some word of caution you need to kind of assess it as to what's going on. The other possibility is there may be some blood tinged in the fluid. Now, a little bit of a blood in the amniotic fluid is not a cause for concern. There is a little mucus that passes, and sometimes that's coated with a little blood. But a heavier staining of brown may indicate old blood in the amniotic fluid, or more active bleeding, a bright red blood may indicate an ongoing process. And I think that should be evaluated relatively promptly by your healthcare team. So normally the amniotic fluid will be clear. And I tell patients, because sometimes it's difficult for the patient to tell, is it truly the amniotic fluid, particularly if the water breaks in sort of a slow trickle rather than a big gush of fluid. And I tell patients it's like peeing in your pants, but you can't control it. So if you have enough fluid, it's running down your legs into your shoes, it probably is the real thing. And good idea to get in touch with your hospital or get in touch with your obstetric providers.
So speaking of what you should do and shouldn't do, and how to get ready, how to get your body ready, but during pregnancy, should you stop exercising? Should you start exercising? And what kind of exercises would be probably most beneficial?